Just trying to give a little bit of the behind the scenes information for people who don't truly feel like it's a detrimental this second or someone will die type of thing. This is like the parents who call up saying, you know, my adult child has been in and out of rehabs or trying to get to rehabs and never gets to get into rehabs, and how do we get them into rehab? Needing rehab is not actually an emergency, and the person that needs the rehab needs to want to be there. This is going to be one of the most important things that I will express, and one of the most important things that I tell families and have told families for years when they call about getting somebody help. Unless the person wants help, unless they are ready to change, unless they are asking for help, they will not be helped. I know that is a really hard thing to swallow, but it is true. This goes for medical, this goes for mental health, this goes for addictions, this goes for everyday habits, everyday changes. If you or the person that you want to help is not ready to change, is not all in with wanting to change, it's not up to you and it's not going to happen. I understand that this is different with children. I am not saying that your children, you know, can't get helped if they don't want help. That's different. I'm talking about adults at this point. I'm saying, you know, you can try and try and try. This doesn't, you know, mean you can't talk to them about it and you can't have, you know, some type of an intervention if that's what you and your family feel like you need to do. If, you know, give them an ultimatum, you know, I know that that's a thing. You know, people say like, I'm going to leave this relationship if you can't stop drinking. I get that. But what I'm saying is you cannot force someone else to change. You cannot force someone else to take the steps they need to take. And there are a lot of steps to take when it comes to something like mental health or substance abuse. Sometimes the best thing to do is just to kind of educate yourself, give them the information. Here's a list of places, whatever it is. Here's, this is why I'm creating an actual document that explains which type of services you know, what state of mind you have to be to go to certain places to get the help you need. Because sometimes that's the only way it's going to happen, but they need to make the decision. And I'll talk separately about children, but that's one thing I just wanted to say was that I know it's really hard to hear that, but if your adult child, you know, is going to rehab just because you're like literally like putting them in the car and forcing them to rehab, it's not gonna work. It's not gonna work because they're gonna get there. I shouldn't say it's never gonna work. Some people may get there and have this like revelation and like actually, you know, go through the motions and do the things they need to do. But if they're not making the decision for themselves, more frequently than usual is that they either don't finish the full program or they do finish the full program, but they either go right back to using, or, you know, they're just doing it for you. You don't want them to do it for you because that's not going to make them continue that path. If they seem like they're wanting to, but they're just having a hard time, then yeah, that's absolutely a different scenario. There's going to be different levels. Think of it as like, you know, a 0 to 10 scale. 0 obviously would be they don't want to get better. Like they just don't want to get better. They don't want help. They don't want to go to therapy. They don't want to go to detox. They don't want to stop drinking, whatever they're doing. They don't want to stop it. You have this entire spectrum up to 10 where somebody is all fully devoted into, you know, getting clean, going to therapy, getting help that they need, going to anger management, going to marriage therapy to fix their marriage. That's a spectrum. You can have people that are down here at like an 8 that they, you know, they want to get better, but they may not be fully ready to take the steps that actually need to be done because they're not fully engaged yet. They're not, you know, they might still be at the kind of excuse stage, you know, well, like, I don't have time for therapy. You know, my significant other won't go with me, or, you know, but I have XYZ parties coming up and I don't want to have to not drink at them. Like, there is always going to be a spectrum of where the person is in terms of wanting to change.